Hi, I'm Dr. Noelle Lucas at Blue Oasis Pet Hospital, and I'm here to answer some more questions you might have about cat surgery, especially mitigating risk. So I've got some questions to be asked.
Dr. Lucas, are there risks associated with cat surgery?
So yes, cat surgery is just like our surgery. We are going to alter those tissues and evoke inflammation. We're going to evoke bleeding, and maybe infection can be a part of surgery. So yes, there are risks to surgery, and you need to ask your veterinarian what those risks are, particularly regarding the type of surgery that your cat is going to have.
How can the risks of cat surgeries be minimized?
How can the risks of cat surgery be minimized? So for us, it would be how do we control, so this would be back to anesthesia. So there's anesthesia safety, and then there's surgical safety. So surgical safety would be using sterile instruments, properly autoclaved, so sterility, preparing the surgical site properly, so proper clipping, proper aseptic technique. So that means cleaning the surgical site appropriately. We're an AHA certified hospital, so we do have standards that we have to meet to mitigate infection. So that would be how we reduce infection risk, would be how we prepare the surgical site. For us also in the dentistry space, because we're doing a lot of dental surgery, it's using good technique, using proper instruments, sharp instruments, using instruments only one time, like dental burrs, and replacing those. So there's lots of things your veterinarian can do to help get that surgical site prepared carefully and correctly, and also to help reduce infection afterwards.
Are there side effects and possible complications of surgery for my cat?
Are there side effects to surgery after? Yes, there can be, and complications. So yes, because we're doing something surgical, there's always the risk of some complications. So we just talked about infection being one of the most common types of complications after surgery. Another would be cats do like to sometimes lick their surgical site. So opening up the surgical site, or that would be called dehiscence, because your cat licked at it too much. Sometimes we'll see inflammation in the form of swelling. So like a cat spay, we could see seroma, so that would be a swelling because they're being way too active too soon, and there's some fluid that's getting into that surgical site. Rarely we could see a complete dehiscence of a surgical wound. For example, if we're going into the abdomen and we make an incision all the way into the abdominal cavity, dehiscence of the surgical site would be all the sutures let go. I maybe only seen that one time in my career. It's really rare, but that would be a surgical complication. But again, how we prepare that surgical site and how your cat is taken care of afterwards can really help mitigate those risks.
Will my cat be monitored, and will my cat be intubated?
Yeah, so again, if your cat is going under general anesthesia here at our hospital, they will be intubated. A tube will be put down their throat, and they will be monitored both by a certified or a qualified individual to monitor them, as well as monitors electronically, so that we're able to make sure that they're safe while they're under general anesthesia. So if you have any questions about cat surgery and the safety that we have around general anesthesia and surgery, please reach out to Blue Oasis Pet Hospital.